Senator Collins.
Thank you, Mr. Chairman. Dr. Martinez-Lopez, let me follow up on the mental health issues that are of such concern to this subcommittee. You mentioned the Department's Suicide Prevention and Response Independent Review Committee, which recently released a report with numerous recommendations aimed at reducing the number of suicides. I want to make a couple of observations about that report before asking you a question. First, it is evident that the department needs to reduce the time that is required to recruit behavioral health specialists. In one example cited in the report, it took on average a year and a half to hire civilian psychiatrists and almost a year to hire psychologists at Walter Reed. So it's not a big surprise that half of the psychiatrists ultimately declined the position after that long delay. Undoubtedly, they went elsewhere. And that is unacceptable that we're losing people because it takes so long to bring them on board. Second, TRICARE's policy guidance is that 98% of the claims submitted by providers should be completed within 30 days. Yet the report found that behavioral health providers were reluctant to serve military beneficiaries because it took so long for TRICARE to pay them. One provider cited in the report said, "It takes forever to get paid a pittance, if you get paid at all." So obviously our military force will be stronger and healthier when more providers are available and more of them are willing and eager to accept TRICARE coverage. So here's my question. Will the upcoming budget requests include funding to implement the committee's recommendations?
Senator Collins, first, the Secretary and myself, I'm very grateful to the members of the committee for spending their time to come out with the recommendations, study it out, and helping us out with this big issue. Second, is the Secretary right now has a team, and we are leaning forward each of the recommendations, and we're looking at ways to, first, which one we're going to be able to accommodate first and which ones are going to come. And in that process, there will be issues of budgetary requirements. I'm not prepared to tell you what those are look like right now, but I'm telling you, we as a department, we're looking at all the one by one and addressing A, are they viable? Two, what will it take to implement those measures? So as we are ready to do that, we'll come back to you with the specifics, ma'am.
Thank you. General Crossland, just yesterday I met with a group of veterans from Maine who told me that the rollout of the new electronic health record system within the VA is still very problematic. Obviously, even if DoD is going to have its new system and 75% of its hospitals, as you testified, by the end of the year, if the VA's not in sync, we're still going to have a problem with transferring medical records once someone retires from the active duty military. And the veterans were telling me example after example of where they had difficulties in chasing down records, getting them to the VA. So how is DoD collaborating with the VA on the electronic health records rollout and ensuring that once it's fully implemented, that there is the interoperability that we've been talking about for years,
Senator Collins, thanks for the opportunity to comment. First, ironically, last week I spoke with a senior leader within the VA and offered up the opportunity for them to come and witness our rollouts and to learn from our lessons on how we're able to execute our rollout and potentially things we can offer for them by sharing the lessons learned. With respect to that value of the record, there's a lot of value with the data, as I mentioned in my opening comments, having the right information, being able to follow service members from the time they're assessed all the way to the time they transition. And obviously, if there's a further delay in the VA's rollout, we would have to work through how we would hand our MHS Genesis electronic record that we're going to be on by the end of the year to the VA. We haven't gotten that far yet.
Thank you. I'm sure the chairman's going to solve that problem in his dual role.
No problem whatsoever. Moran's going to help me do it too. Senator, right? Yes, sir. Okay, good. Look, it's a very good question, and I will just say that I don't know that there is anybody that is not frustrated with the whole electronic health record, the billions of dollars that are being spent, and it doesn't appear that we're moving the ball. So we've got some work to do.